Welcome to Public Health Matters, where we talk about matters in public health. I'm Jane Goodman, Communications Specialist with the Nashua Division of Public Health and Community Services. And I am here today with Angela Consentino, our City of Nashua Epidemiologist. Welcome, Angela.
Hi, Jane. Thanks for having me.
Well, thank you for agreeing to come on again.
I'm a public health rock star.
You are totally a rock star, getting all the interviews and very busy these days.
Yes.
But it really helps our viewers to really understand what's going on because it's constantly changing. And we really want people to understand that these numbers they're seeing are real and they have some meaning. So why don't we start by having you give us the COVID-19 update for the city of Nashua and globally. I think people do want to hear that, and we'll put some slides up so people can kind of follow along.
Sure. Yeah. So cases are rising not only in New Hampshire, but across the country and in the world. We have 52.8 million cases worldwide right now. And then across the U.S., we have 10.5 million cases. And the states that are getting hit really hard right now are the northwestern states, so North Dakota, South Dakota, Minnesota. They've seen sharp increases in their curve over the past 3 or 4 weeks. And so then here in New Hampshire, we have also been seeing an increase in our curve. Since the end of August, we've been seeing an increase in cases. We're at 13,470 cumulative cases in New Hampshire right now. So it's a lot of cases.
Right. Even for a small state, it's proportional. So to have that many, it's alarming.
And only a portion of those are active right now. So a lot of them are recovered. But for example, in Nashua, I believe, we have 295 active cases. So that's a lot. So week by week, over the summer and at the beginning of the fall, we were at like about 100, 120 active cases per every, week or so. And now we're up to 295 active cases.
Wow, for just a very short period of time, for 1 week.
Yeah, so we're definitely, we're seeing an increase. And we're seeing a lot of new cases, and with those cases come their contacts. Luckily, we've been seeing mild illness. So we have people who have, a sore throat, a cough for a couple days. They may lose their sense of taste or smell, but we're not having severe illness like we had seen previously yet.
But hospitalizations have gone up a little bit.
Hospitalizations have gone up a little bit, but our deaths have remained the same. So this may be an indication, maybe because, our long-term care facilities haven't gotten hit as hard as they did in the spring. But, we'll just see, time will tell.
Right, and we have a little bit more experience with it. So I know for long-term care facilities, we do some weekly testing and really try to stay on top of that because it's such a high-risk population.
Yeah, we have a much more robust surveillance system in place now than we did in the spring when this was brand new to us.
Right. So are there any other numbers that we wanted to talk about today? Or I know you brought along some graphs, so we can put one of those graphs up.
I'm an epidemiologist.
I don't know if you brought it. Yes, Angela loves graphs, and I love reading your graphs.
Oh, thank you. So I just wanted to talk about this Nashua weekly cases and average contacts per case graph. So this shows that the bar is the number of cases each week, and the line is the number of contacts per case. So you can see last week our cases skyrocketed, and our average contacts per case is at a little bit above 2. So this number had been steadily increasing over the fall, and now we kind of see a dip and a bit of a bump up since the week before. But it's good to note that we're at an average of 2 contacts per every case. So this kind of transfers. It's not exactly the same, but it's very similar to the reproductive number. So the reproductive number is the average number of people who will be infected from one case. So we call it R naught. And so that is for COVID-19, when there is no intervention in place, it's 2 to 2.5. So about 2 people on average are infected from every 1 case. So at the beginning of this, before we had more information and we were all new, it was originally thought that every case was going to infect 2 people. And then those 2 people would go on to infect 2 more people. And you can kind of imagine the tree that comes
Right.
off from that, right? But what's so interesting is now new research is showing us that it's not every person infects 2 people. It's 1 person infects 16 people, and then 6 people don't infect anybody. And then another person infects 25 people. And then 6 people don't infect anybody, or they just infect 1 person.
Okay.
So the pattern of infection isn't this nice kind of tree
This little
shape.
symmetrical tree.
Yeah, it's
going.
more like little bursts
Right.
of infection all over the place. And so why that is relevant and interesting is because that shows why we're so cautious about our congregate settings and any outbreaks or clusters that we may have. So it's so important for us to continue our cluster and outbreak investigations, because those are the places where the opportunity for these super spreader events really are.
So you and I have been doing some contact tracing.
Yes,
I mean,
we have, yeah.
I've only really been doing it for a short time, but been following, the pattern of it. So, we can't emphasize this enough, how important contact tracing is, and that there is a pretty large group, pretty small group actually, of people dedicated at public health to calling people that have tested COVID positive, and following up with them. And could you just walk us through why we do the contact tracing and the kind of things we're going to ask and what's important about it so that people understand?
Sure. So the whole point of the isolation and quarantine of cases and their contacts is to stop the chain of infection before it can begin. So it's something, they call it, actually it's called like the ancient rule. So they did it with smallpox, and it was done with Ebola. So people were all very familiar with this concept of quarantine and isolation. So it's nothing new.
Right.
But what it is it's making sure that people who are sick don't have contact with other people, so they can't make them sick in the long run. And then it's preemptively quarantining the people who had been exposed to positive cases, because they do have a higher chance of becoming sick than someone who wasn't exposed, quarantining them so that they are not asymptomatically transmitting or going about their regular business when they're actively shedding virus.
Okay.
So it's quarantining the contacts, and then isolating the cases. And so the cases are sick people who are isolated at home for 10 days after their symptom onset date. And then the contacts are people who are exposed to those sick people who need to remain quarantined for 14 days after their last day of exposure to the positive case. So that's because the incubation period is 14 days.
Okay.
So after you've been exposed to a positive case, it takes about 14 days. It takes full 14 days to possibly develop symptoms. On average, people develop symptoms 5 to 7 days after exposure.
Okay. So there's like a lot of numbers to remember, but the important thing is when we reach out to the contacts, for example, if you and I live together and you are COVID positive and then they call me, I also need to monitor for symptoms. And that's a really important part. Not only am I quarantining, I'm not staying to one bedroom in the house, as someone who's on isolation should probably do, but I need to make sure that I'm not coming down with that sore throat or that stuffy nose or that cough or shortness of breath, all of those things. So it also creates an awareness in the community. So we want people to be aware that they should be monitoring themselves as well. And even mild symptoms, like you said before, have been a sign of COVID-19 now.
Yeah, and so that's why it's so important even if you have just like a little bit of a mild symptom, to not go to work, not go to school, to stay home. Don't go visit any elderly relatives or anything like that, even with just like a sore throat or like congestion or something. And it's so important because then it protects those people from getting sick.
And we talk about how to minimize our risk always, what can we do during this time? So I always go over all of these things, usually every show, because I want people, I don't think that we can say it enough, and how important it is to wear your mask and to wash your hands as much as you can when you're touching different things, and coming in from outside or coming in from your office or wherever you've been. If you've been out shopping, just wash your hands with soap and warm water for at least 20 seconds. You want to wipe down those high-touch surfaces. Stay home if you're sick, of course. You know, if you have that any inkling, and call your doctor. See if you can get a COVID test, because prevention is really important at this point. Also, get a flu shot. Is another thing we've talked about.
Yeah, and another important thing to remember too is that now we're at community-based transmission in Nashua. So when you go out into the community, you can assume that someone in the community is positive with COVID-19, and someone that you're coming into contact with is going to be positive. So when you're at the grocery store, think of the percent positivity rate. So if we have like about a 4% positivity rate, and there's 100 people in the grocery store, you can assume that 4 people in the grocery store with you right now have COVID-19.
Wow.
So it's just for your awareness. So it's hard to think that way, but when you assume that people are sick around you, it helps you be more hypervigilant and continue with your infection prevention.
Right. So keeping your space and not standing too close, not standing so close, and engaging in conversation. And you know, if you are visiting with someone, if you can keep it outside. I mean, not on a day like today, perhaps, but you know, in general, if you can be outside and you know, that is such a healthy thing anyway. So keeping those kind of things in mind as we move forward. So when you talk about community transmission in the Nashua area, there's certain metrics we look at, and we talk about per 100,000 people. And that's like a standard epidemiological number. They love 100,000, you know, but it's very confusing for people. You know, I've seen people post about, well, if there's 160 per 100,000 and you divide it, that seems like a low percentage. But why are we concerned? You know, this is a metric that we have from the state and the CDC, I'm assuming. Anything over 100 cases per 100,000 in our community is considered substantial community spread. What are we at right now in Nashua? I don't have that exact number. I know what we were at on Monday. The state system was down this morning. So.
So on Monday we were at 173 cases per 100,000.
So it has not gone down since then because we've gotten loads of cases. So.
So really what it is, so this says new cases per day over 14 days per 100,000. So really that's just a fancy way of saying the incidence rate. It's kind of just defining the incidence rate. So it's just the number of new illness in a community at a point in time. And then it's per 100,000 people so that we can standardize it between communities. So the reason why we just don't say the number of cases is because in Nashua, it's hard to compare ourselves to, you know, Amherst or Wilton or something like that because the population sizes are so different. So that's why we use cases per 100,000 so we can see if there's any areas that are being more heavily impacted regardless of population size. And in Nashua, we are one of those places. We were one of the first communities on that map to be in the red.
In New Hampshire.
In New Hampshire, which is the number of new cases per 100,000 over 14 days.
And there are other metrics we look at as well. We look at hospitalizations and percent positivity.
Yes, so we look at the hospitalization rate. That's per 100,000 over 14 days as well. So that's just the number of new hospitalizations in our community compared to the total number of cases. And then we also have the percent positivity rate, which is the number of tests, PCR tests that come back positive compared to the number of PCR tests that come back negative. So it's just the percent positive of those tests. And that's really a good indication of spread in the community because regardless of the number of tests that are being done, we can tell how far the infection is spreading. So if the percent positivity is really high, even if we're only doing 2,000 tests and the percent positivity rate is really high, it shows us that we have community spread, or it shows us that sick people are the only ones who are seeking testing, because that would make sense as to why the percent positivity rate was higher. But say we can have 10,000 people get tested and the percent positivity rate is still high, it shows us that we still have an issue in the community. So that kind of counteracts the argument that just because we're doing more testing, we're going to see more cases. Because yes, that's true, because the more people that get tested, the more cases we're going to have. But the percent positivity rate shows us the true spread of infection in the community.
Right, so it's really important to understand the percent positivity. I'm like kind of a junkie. I check in the different states where my family lives, where my daughter's in college, those kind of things, because I really want to know. And when we see that number grow, and it really has, because, like you said, in the summer since August, we were at 1%, 1.2%, and now we're at about 4%. So that's a big leap, even though we're still at small percentages and we haven't hit that 5%, which is where the alarm bells go off. That's a big growth rate in a short time.
Yeah.
So I think that people really need to keep that in mind. Like we're not done with this yet.
Yeah, and it's also good to note, too, that back in the spring, our percent positivity had hit 17%. Okay. So we're not where we were back in the spring in regards to percent positivity, but we are there in regards to the number of new cases per day. So it's just going to be interesting, when this is all over, to compare surge to surge. We can say spring 2020, fall 2020. It'll just be interesting to do that.
I'm going to remind you that you said it's going to be interesting. When we're in the office trying to figure out who saw who and why they did that. But, it's all good. And we thank you for all the work you're doing at the health department and your dedication to all those numbers. They do keep us honest, though.
Yes.
And it really is important that we understand what's going on, because every time, if we can let people know what's going on in the community, that these increases are going on, they can stop before they leave their house. They can think about what they're going to be doing. And we're not saying don't go out, but we're saying think about what you're doing. Do it safely. Wear your mask. Keep it outside. Do those things to minimize your risk. And it keeps you healthy. It keeps our community healthy.
Yeah.
So we just, I always say, we can't emphasize this enough. These are hard times. We've been doing this a long time. But right now we are seeing a sharp uptick. And we really need to be vigilant, and we really need to think before we leave our homes about what we're going to be doing.
And the bubble thing applies there too. So, if you go out to an outdoor restaurant, or you're going to like a farm or something, if you're going with the people in your household, you see those people anyway, so you don't have to social distance with the people in your household.
Right.
And you can go out and do social activities with the people that you see all the time. But maybe, you don't want to go out with people that you haven't seen in months just to catch up. It might be a good idea to call that person or FaceTime that person, but maybe not see them in person, just to protect yourself and to protect them.
Right, because we're all coming from different areas and different places, and we all have different exposures. So when we put them all in one room, it's really not the best idea. Yeah. So we have to kind of hang tough through the holidays and keep washing our hands, wearing our masks, and doing our thing to stay healthy. Any last parting words of wisdom?
No, I just think that, this is a new time, so it's kind of, we're transitioning from the way things were from before COVID into the way things are going to be after COVID. So I think, for me personally, I think it's a great opportunity to kind of change my traditions and change the way my holidays worked and change the way, like, I view certain things. So like with the holidays, instead of having a large celebration, I'm going to focus on having a small, intimate, like, family gathering. And I think both things are good, but now I'm just looking forward to being able to enjoy the holidays in a new way.
Right. So at our house we'll just be, well, it's not so small, but there are 6 of us. But it'll be nice. It'll be nice. We'll just have that family time, and we'll Zoom in Grandma. Yeah. And or maybe with Facebook or whatever. We like that too. But we'll figure out how to get all of us into one room at one time, and it'll be different, but it's still a holiday and still take some time to be with your family.
Yeah, and different's not necessarily worse or bad. It's just different. So.
And I always think, like, with some of these precautions, like the washing of the hands, I mean, we should be doing that anyway.
Yeah, definitely.
Pre-COVID, post-COVID, you should be washing your hands.
Hopefully people are getting less foodborne illness and less other things that are associated with not washing their hands because they're doing so much hand washing.
Right.
So that'll be interesting to see, foodborne illness, like what's going on with that, because that's transmitted a lot through hand to mouth.
Right.
So
So,
you're not only protecting yourself against COVID, you're protecting yourself against a slew of other
right.
things.
Well, on that note, thank you for that silver lining. The silver lining of COVID-19.
Yeah.
We really appreciate you coming on, Angela, and just want to remind people that we do have a COVID testing clinic every Tuesday from 3 to 5 p.m. in the Elm Street parking garage. And you can go online to make an appointment to the Division of Public Health and Community Services, or you can call our hotline at 589-3456, and we'll be right back with our next guest.
Before returning to play, kids, coaches, and parents can follow these tips to protect themselves and others from COVID-19. Stay home if you're sick or have been around others who are sick. Wash your hands with soap and water for 20 seconds, or use hand sanitizer with at least 60% alcohol before and after practices or games, and before and after sharing equipment. Bring your own equipment, like gloves and bats, if possible. Don't share towels, clothing, or any items used to wipe your face or hands. Keep your belongings separated from others, like your gym bag and equipment, when not in use. Avoid physical contact, like high fives, handshakes, fist bumps, and hugs. Let's start the season with healthy practices. For more information on what you can do to keep players and coaches safe, go to cdc.gov/coronavirus.
And welcome to Public Health Matters, where we talk about matters in public health. I'm Jane Goodman, Communication Specialist with the Nashua Division of Public Health and Community Services. And I'm joined today by Rene Beaudoin, who is our Deputy Health Officer at the Nashua Division of Public Health in the Environmental Health section. And thank you, Rene, for joining me today.
I am very glad to be here, Jane. Thank you.
So Rene is fulfilling his role today. He has opted to keep his mask on. We are 6 feet apart by a nose, but I had to take my mask off. It's just easier, but let's talk about that, Rene.
Yes.
Before we get started, I mean, the importance of mask wearing, and then we'll go backwards. But right now, let's talk about that mask wearing, because it is something that we obviously promote from public health. And we have some new studies coming out, a new study that came out and a new recommendation from the CDC. So why don't we start with that?
Yeah, and I think it's really good, Jane, to go back and think about how much we've learned about masks over the last 9 months, right? So these last 9 months have felt like 9 years in terms of how much research that we've been able to conduct on mask usage, right? Because 9 months ago, everyone was saying, right, we didn't really have to wear masks. Masks were for sick people. And then as we learned more about this virus, we realized, right, people could have this virus, not show any signs of it, and yet be shedding it. So then that message turned into, whoa, you know what, we have to control that source, so everybody wear masks to protect each other. But now the more research that we're doing is also showing that the mask not only guards you from me, but me wearing a mask and you not having one on right now can also give me just a little bit of extra safety, because it does add a impact of filtration. So but I will say the quality matters, right? So you just can't wear a single layer, very thin kind of mask. You really want a nice mask that has a couple layers, good cloth quality, much like the mask that we both have. So yours is sitting there,
Right.
which is very nicely. It's a beautiful mask. It's just like this mask here. It has a nice outer layer and an inner layer. So it has that double layer to really filter out some of these particles that are flying around, in the air that we can't see. So not only now do we know that it protects other people from us, but it can also protect us from other people.
Great, and it also has a really nice logo on it,
It does,
too.
a beautiful logo.
So I did this thing at home, because of course you see it online, where you try to blow out a candle. Does that have any bearing on anything? Because I will say that this mask totally passed. I could not blow out the candle. I tried a bunch of different masks, And does that mean anything? Does that tell us anything? Just,
Yeah,
for the people that want to know.
Excellent question, and I'm not sure the best answer to that. But clearly, the more or the harder it is to get something through this mask, the more layers which are there, the harder it is for to get the stuff that's in you outwards and the stuff that's outwards in. So if you're trying to blow something out through this mask and that wind, that air is not going to get through, then that's at least telling you a very crucial factor that most of what you're breathing out is staying close to where you are.
So I'm keeping it.
And that's crucial, right?
in.
Because if we both weren't wearing masks, and hypothetically, I was sick or you were sick, and as we talk, these particles come out and they come moving around, and there's all these different sizes of them. The bigger ones, these bigger droplets will kind of come out. They'll actually arc, and they'll land about 3 to 6 feet away. And those are your larger droplets. So this is safeguarding me from kind of sending those larger droplets towards you. But what it's also doing is these smaller particles, and instead of having them build up and spread further, it's keeping them a lot closer to where I am.
Okay.
So really, I'm the only one right now that's going to be exposed to the particles that I'm breathing out. Over time, they'll build up. But right now, this mask is really good at keeping everything close to the source, and the source being us.
Right. So it's like hands to yourself. You tell little kids,
Correct.
Keep your germs to yourself.
That's right.
Keep your air to yourself.
That's right.
So to speak. So let's back up, Ren. So I wanted you to come on today to tell us a little bit also about like the Environmental Health Department at Public Health. And let's just really back up to what you are supposed to be doing during normal times.
Right.
And they will arrive again. We don't know when. But what was the role of environmental health during, day to day before COVID?
Yes, so the Environmental Health Office, we are the enforcement office of public health. So we will enforce the public health laws. Primarily what our office does is we license and inspect anywhere that sells or serves food.
Okay.
We license and inspect any pools that are for public or common use. So that could mean a pool at a sports club, at a hotel, at a condo. So all
And
those.
we have some public pools in Nashua.
We've got plenty of them. Yeah, and we have the actual pools, right? So we license a little over 100 pools.
Oh, wow.
We also inspect any of the septic systems that are here, which you wouldn't think a city has a lot of them, but we have well over 1,000 of them.
Really?
Yeah,
See,
mostly
you learn new
on the
things.
outskirts.
Okay.
Of town. And then we have our arboviral program, so the little creepy crawlies that can spread illness like triple E and West Nile virus.
Okay.
So we do a trapping program through a contractor throughout July through October. Those are our higher risk months. And then our rabies control program as well. So any dog bites, we want to make sure that dogs are up to date on their vaccines, so we can probably stop that virus too, right? So that's an extremely deadly virus, not like this one here that we are dealing with now, but it is a very high-risk virus, which is why we have to vaccinate our dogs and our cats to make sure that kind of stays and really doesn't spread either.
That's a little bit easier to track than COVID.
It is, yes, it
more
is.
obvious
Much
when it's
easier.
been transmitted.
It is, yes.
So as it was in February, very busy department because that's a lot of pools. That's a lot of
pools.
restaurants.
Yeah, we licensed about 530.
Yeah, so very busy department and small staff.
Yes.
However, now we're in a totally different scenario, and you're really focusing on, I would say, COVID compliance or safely opening, or
Yes.
giving guidance, really.
Yeah, and that's probably one of the biggest roles. So even though we are here to enforce those public health laws, our primary role is to educate, right? We don't just want to go in somewhere and, walk in there with a strong arm and say, you're just doing stuff wrong, you have to stop. What we go in there for is to educate them and say, you know what, you can't do it this way because of X, right? There are reasons, there are health reasons that we have learned throughout the years due to research showing, why it is that we have these certain rules. So in 2020, with COVID, that has morphed into trying to educate people why the restrictions that were out there and are still there are still present, and why we expect some of those to move forward. Because it's all about safety, right? Nobody wants to get anybody sick. But if you don't understand the actions that you're doing could potentially get someone sick, then you could get someone sick and not know about it. So we're there to really educate. That's our first role. That's what we've been primarily doing through this.
Okay.
We've been doing a lot of outreach, working with our restaurants, working with our pools, with any of our field workers. We also go out and inspect foster homes and childcare. So we're reaching out to those groups to really say, how do we keep you safe, your staff safe, your patrons safe, or your kids? And we really want to make sure that every action that they take is to maximize safety. So that's our primary role right now. On the other side of that is those compliance checks, right? Because there are guidelines, there are mask mandates here, and we want to make sure that people are following those because, again, they're in place to keep others safe. And so sometimes, by and large, most restaurants, most businesses, they're doing an excellent job. They really do want to make sure that everybody's safe. Once in a while, we get those people not so much. So we have to go in there. If the education doesn't work, then that's when the enforcement comes in. But we work with our partners. We cannot do this by ourselves. So we work with the police department, with the Attorney General's office, and we take those steps to make sure that the safety happens.
So it's good. We always say public health happens in partnership
Right.
because clearly this pandemic's bigger than all of us.
It is.
So just briefly touch on the restaurants because the restaurants are open. The governor has allowed full capacity.
Yes.
With some barriers, and we have this new thing, sign in to dine in, which we thought was a fabulous idea. We like to think that we even came up with it before
That's right.
before the governor, but so people should just be aware that you are going to be asked to sign in. You are going to be asked what table you're sitting at. The restaurant will fill in who your server is. And what time you were there. And we do that, for safety reasons. And if there is, by some chance, an outbreak in the restaurant or a confirmed case in the restaurant, we know who was there. We know who was exposed. So that was a really big step, I think, for us to take. I know they were doing it in Massachusetts for a while, but it's very important now, especially with cases on the rise.
Yeah, so it is a positive step, right? So this is something that, we'll be honest, doesn't really keep you safe, right? So just giving your name and
Of
your
course
phone
not,
number
right.
isn't a safety measure. So we don't want to essentially send it out there that we're doing this to keep you safe. But what we're doing really is it helps us trace faster, right? So if there is an exposure and you were there, and maybe the table next to you now placed less than 6 feet because they got this little barrier there. Just because that barrier is there doesn't mean that that's going to be, an extra really safety measure in terms of what we would classify as a close contact, right? So less than 6 feet for greater than time X, 10 minutes, But what that really tells us then is that if a patron calls, which this happens lots of times, they call and say, hey, I just want to let you guys know that I had a positive COVID test and I was at your restaurant on Tuesday. I tested positive Wednesday. So now that restaurant can very quickly go back, look at that sheet, said person X was here at this date, on this time, this server. They sat at this table. We know who sat at all these other tables, which are close by.
Right.
Now we can notify those people and say, hey, you were potentially exposed to someone that had this virus.
Right.
So now they can take those safety measures to keep themselves safe and also to extend that safety to maybe people that they're caring for, household members, older parents maybe,
Right.
other people that may be at higher risk. So we can kind of make sure that safety net then kind of stops there. So breaking that chain at that point, we would love to break it earlier, but at any link along that
Right.
chain, if we can break that at any point, that is very helpful.
Yeah. So you reminded me as I'm listening to you describe this so clearly is also one other thing, beyond restaurants and pools, you've given a lot of guidance for the schools and for school sports and how to limit their gatherings. And that's been a really critical role, I think, of public health because, again, we're delving into so much unknown when we're here. And so, we give guidance, of course. It's not necessarily always accepted, but we do want to give guidance. And one thing you and I had talked about earlier was that a lot of our guidance comes from the state And then we always follow what the state, we start with the state guidance. Sometimes we are stricter in Nashua, or, you know, we have a mask mandate, for example. Are there any other examples that you can think of that, you know, where Nashua is a little bit more cautious, or?
Yeah, well, you know, I think we're very fortunate here because we have a lot of excellent people that work for us with a lot of different backgrounds. So we bring a lot to this table, right? And so one of the things that we've done, which a lot of people didn't do early on, was looking at the air quality, right? Because we knew a lot of different things, right? And I think there are three major things that people have to understand in assessing what their personal risk is. And this is something that we really tried to educate early on. So our viral exposure risk is a result of the concentration, right? How close we are to a known source, and time, right? So we take that concentration, we multiply it by the time that we're spent with it. That's going to give us what the exposure risk is. That's not to say that that's a finite number. We can't say that it's 10 times 10 is going to give us 20. Anything over X is a high risk. But what we do know is that if on either of those columns, the concentration column or that time column, if we can minimize either one of those, we're automatically going to reduce our risk. If we can minimize both of those, we're going to greatly reduce risk. But lots of times we don't have an option in one of those columns, right? So let's say we're at work or we're at school. We have to be in a classroom X hours a day.
Right.
So that time column right there, that isn't changing.
Yeah, it's not very movable.
Right, it's not very helpful. So now we have to move, what can we do to reduce our exposure to that concentration? Knowing that a lot of people out there may have this virus, but not be showing signs of it. So there are very easy steps that we preached early on, right? Wear your mask, keep your space, wash your hands. Very, very simple steps. And you can think of it this way. This is the best way to educate family, to educate friends. If we're in this room, right? So think of this room as your lungs, right? If you have to breathe in, things have to get into your lungs, right? So we can imagine the doorway that we walk through as that entry portal to our lungs. So if we're not wearing a mask and there's virus that's floating around here and we're breathing in and that door is wide open, that virus is going to come in, it's going to land in our lungs. If it's the right dosage, right, then it's going to start growing, it's going to multiply, it could get us sick. So automatically we say, how do we reduce that concentration, that dosage that could walk in through these open doors that can land in our lungs? So step one, masking. So again, why I'm wearing this nice, beautiful mask, right, is that...
It matches your clothes nicely,
yeah,
too.
I know.
You really put together.
And I did that on purpose. It doesn't happen very often, Jane. But what this mask does is it doesn't close the door, but it can partly close it. And so these viruses, they're not sentient, they don't think, they're not living, they're just kind of floating around. So it needs to kind of just happen by that nice doorway to land. So if we put a mask on, again, we're closing that door slightly. So now it's not a wide open door, it's a partly closed door. So now the viruses have much narrow area to get in.
To enter,
so we are reducing risk. That's step one.
Okay.
Step two is to further reduce risk is to keep our space, knowing that the infectious source is other humans, right? This is a respiratory illness. So if I'm standing in a field with a bunch of dogs, completely fine, right? But if I'm standing in a room with a bunch of humans, now risk has gone up.
Right.
So if we keep our space of at least 6 feet, now we're again making it less virus because we're further away from that source. So that concentration now is even lower. So that door gets even narrower. So now less virus gets in. So that's a fantastic way to really image exactly what could come into our lungs. So if we reduce that concentration column, even though we can't change that time column because we're in this workspace or that school space for time X, if we work on that other column, we reduce that exposure risk. Now that's the first thing everybody talked about. The second thing is what other people didn't talk about.
Okay, I want to come back to the second thing, but you're reminding me because we're coming upon the holiday season and people are going to be gathering. I mean, it's human nature. And so I just like to recommend at this point, you kind of given me that segue in a sense, that if you are getting together with people in your home, it may feel weird, but you don't need to be on top of each other.
Right.
You know, keep your distance, wear your masks. When you sit down to a meal, you know, keep it spaced out if you can.
Right.
Because really, when we're all coming from different places, we're all bringing different things into people's homes. And you're really reading a lot about this. Even small gatherings are creating a lot of contagion and a lot of illness. So I wanted to just kind of jump off of that a little bit, just to say, you know, as we approach Thanksgiving and then again the December holidays, you know, you really want to plan ahead and think about how you can be with your family safely.
Right.
And, you know, whether it's a large room or, you know, maybe we're doing TV dinner, so to speak, you know, like
Right.
TV dinner tables,
Exactly.
and we're eating a little bit separate, and it's not as cozy. But cozy is not our favorite word this year, so.
Right. And you actually bring up a great point, and that will segue into the second portion.
Okay, good.
So you are absolutely right. Even in our homes, we don't know maybe where all of the family members work. And some of us may work with high-risk groups. We also have to be very careful. If we know that we are a person that works with a high-risk group, we should maybe rethink the activities that we're doing, because we don't want to bring in this virus to that high-risk group. So how do we do that when we're around family? Just like you said, just because you're in a household that you know doesn't mean you don't have to wear a mask. Doesn't mean you can't keep that little extra space. But now there's extra things that we can do to the room to maximize safety. And that's that second piece. So now we're in our homes, we're with family. How do we keep that safe? So now this is no longer the lungs, now we're in the room, right?
Okay.
So how do we, again, maximize what's coming through those doors?
Can I guess?
Yes, please.
Open a window.
Open a window, definitely the easiest thing, right? The absolutely easiest thing, but it gets cold.
Right.
It gets a little chilly. It may not be the easiest thing, but most homes have a heating system. If it's a newer home, probably has a nicer system that actively can filter air, that can move air in and out. If it's an older home, you may have some baseboard heat, may not be the greatest factor. But there are two major things that you can do to your house, to your workspace, to your school space, to any space really, that can maximize the safety in that space. So one is make sure looking at the air system that you do have in your house. If you have an HVAC system with a filter that can filter air, there's a setting on that you can turn that fan on. So it doesn't have to be actively heating, doesn't have to be actively cooling, but there's a fan setting. Turn that fan setting to a continuous running, right? Every minute for every hour while members of your household are there. So what that'll do is continually filter the air that's in the house. So once again, we're in that concentration column.
Yeah.
We're taking stuff out of the air, it's getting filtered, it's getting trapped, lowering it down.
Okay.
The other thing, if you don't have that, they sell these beautiful little portable HEPA units.
Never seen them.
I know. HEPA filters are wonderful. So it uses this nice filter. It's an excellent quality. It can trap these particle sizes that are really, really small. And what people don't understand, some of the questions that I get, well, the virus is so small, it's so tiny, how can a filter trap it? But people don't think that as we're breathing stuff out, if I had this virus, as I'm breathing it out, I'm not just breathing out a virus particle here, a virus particle there. That particle is trapped in a larger particle, right? So as we're breathing out, there's stuff that's in our lungs. So what happens is, generally speaking, those droplets, those aerosols that we speak about, it's comprised mostly of water, of salt, of certain proteins, and a sprinkling of virus. So really what you've done is you've taken a tiny, tiny, tiny virus particle, and now it's in a larger particle.
Okay.
You still can't see it, but it's there. So now imagine again, this is the room, the virus is trying to get into this room. We have a doorway. So if it was just a virus particle, it could get in through that doorway. Like, it's just me. If I'm the virus particle, I can walk straight in through those doors, easy enough. But since it's not just virus particle, as we breathe it out, it's other stuff that the virus is a part of. It's like me riding a bus. So all of a sudden, if I'm in that bus, because there's a bunch of other stuff with me, and I try to go through this doorway, I'm not going to make it. So that's what that filter does. It's able to trap all these particles, and therefore, if we can take those particles out of the air, once again, we're making it safer. We're going to reduce that concentration and therefore minimize that risk. And that's what the ultimate goal is.
Great. And I said, before with the HEPA filter, never seen one, but I am grateful to my friend Rene here who made sure it was placed right in front of my desk.
That's right. Yep.
Because at public health, we do have to be in the office and we do wear our masks, but it's just that, like you said, that extra layer of circulation and protection. And I get in there in the morning and I crank it to high, much to everyone's chagrin.
I do the same thing in my workspace, but it's also very crucial to know that every effort that we do is additive to the previous one. Masking, keeping your space, washing your hands, adding that extra air movement, all this stuff adds on. So if we have just a little bit of safety from one and a little bit of safety here and a little bit of safety here, all that safety adds up.
Right.
And that can make a huge difference.
Right. And so as we are going out and about in public, because people are out, and I don't know that, obviously we can't stop people, but we do say, everything you do contains some risk.
Yes.
So like what you're saying is just try to minimize that, or just shrink it down. So again, the mask, like you said, wearing the mask, washing your hands, keeping distance from those that are not in your family, those are really critical. Keeps you safe, keeps your family safe.
Yes.
And I just want to add to that people should stay home if they're not feeling well.
Yes.
Crucial. We're seeing a lot of mild symptoms with COVID-19 right now, and people are ignoring, it's seasonal allergies, or I had the sniffles, or I had a headache. We really need people to really be aware, just like you're aware of your surroundings and the risks you're taking. Right. Be aware of the symptoms you're feeling. If you're starting to have muscle or body aches, these are things that you really need. You go and get a COVID test. So we're really encouraging people to take note of that. So on that note, I do want to remind people that we do have a COVID clinic, a testing clinic every Tuesday from 3 to 5 p.m. in the Elm Street parking garage. You can go online or call our hotline at 589-3456 and make an appointment. We are there every Tuesday. It's drive-through, or you can walk up. And Ren, thank you so much for coming today.
Thanks,
and
Jen.
Educating us. And you're totally doing your job by being here, because I learned a lot. But that education is so important. So thank you.
Thank you very much, Jen.